Hello everyone, it's Ravi from the Royal Pharmaceutical Society and I'm back today with one of my COVID-19 updates. Since Tuesday, a lot has happened across England, Scotland and Wales, so I'll try my best to update you on all the key and important points. Anything that I might have missed, do check out the Royal Pharmaceutical Society's website and the hub page for all the latest information on all the publications guidance that continues to be released and launched. In Scotland, new funding for community pharmacy was announced earlier this week, approximately £5.5 million of additional money to support community pharmacies during the fight against COVID-19. Massive well done to Community Pharmacy Scotland for their work in trying to arrange and secure this funding. We also know that PPE supplies are being made to pharmacy teams currently as we speak. In Wales, they've seen some key developments around COVID-19 testing for frontline pharmacy teams that started to be implemented, and we also know there's additional capacity to support the mental health and well-being of pharmacy teams through HEIW. In England, there's been several different announcements over the last 24 hours. We know that new supplies of PPE have been made available to wholesalers today, so pharmacy teams should be able to access this quite readily. If you're unable to, or if there's any issues around PPE supplies continuing, could you please let the Royal Pharmaceutical Society know? We are also pushing the government to ensure that these PPE supplies are funded by the NHS, or at least costs are reimbursed back to pharmacy in relation to their PPE costs. We've just got some information around the COVID-19 testing strategy from the Pharmacy Minister. Pharmacy is included as part of the key workers that will get prioritised around COVID-19 testing. Currently, the government and the NHS is building COVID-19 capacity to enable this to happen, but also to check the validity of these testings to ensure it's safe to be able to do at scale. More news that we hope is going to be coming out by next week. There is a commitment by the Secretary of State, as you may have heard, around testing 100,000 healthcare professionals by the end of April, and we know that pharmacy teams will be included within this testing regime. Further announcement yesterday was Easter holiday funding for community pharmacies in England. Please check out the Royal Pharmaceutical Society and PSNC website for further information on it. PSNC also announced yesterday additional money for a medicines delivery service. We're still waiting on some of the details around that. So once that information is out, that'll be on the RPS website. The RPS will be producing some guidance around how to use the delivery service and the volunteering service, and when it's appropriate to use both in due course as well. We also got some great news this week, and something we've been lobbying for around our wellbeing work is that NHS England and Improvement will be commissioning a mental health and wellbeing support programme that will be open to all pharmacy teams across the entirety of the NHS as part of the NHS People Plan work. This is great. We've been lobbying it for a number of years now, and it's great to see this being recognised during these times. We know that mental health and wellbeing support service will be available to pharmacy teams post COVID-19 as well. So do check out the RPS website on how you can access that support. There are a number of different channels and a number of different levels of support that you will be able to get. In other aspects, we've been working across GB around tackling abuse in pharmacies and in general pharmacy settings as well. We've been working with the government, the Metropolitan Police, with our teams at the Royal Pharmaceutical Society to ensure that there's increased support for pharmacy teams that remain open on the front line every single day, but ensure that we protect our healthcare workers at all costs. We know that the NHS and government are publishing some communications next week to the members of the public about respecting pharmacy teams and supporting them during these difficult times. We are doing some further work with the Metropolitan Police, and more information around that will be coming next week. We're also working on stuff around medicine supply chain and giving pharmacists greater autonomy around managing the medicine supply chain, particularly at a much more local level. We're also calling for the abolishment of prescription charges, particularly within England at the current moment in time, to help ensure there is a reduction in pharmacy administration, reduce transmission of COVID-19, alongside ensuring that people get appropriate access to their medicines. In relation to medicine supply, we know there has been emergency legislation laid to empower pharmacists and their teams to be able to manage controlled drugs much more effectively without a prescription, but also around supervised consumption. And we expect some guidance to be provided on some of that stuff, hopefully next week. Key work from the Royal Pharmaceutical Society that's been happening over the last couple of days. Today we published a new ethical framework for pharmacy teams who will be needing this to help with some of the tough decisions they will be having to make around managing members of the public, patients during COVID-19. That's available on the RPS website, free to everyone to access. We've also in the process of developing a NHS volunteers guidance with other pharmacy organisations and how pharmacy teams should approach this, particularly around DBS checks and the difficulties around some of that. That will hopefully be on the RPS website later today. If not today, then by tomorrow. We've had supermarkets across Great Britain confirming that pharmacy teams are part of the NHS Key Workers Programme and enable them to get priority access to shopping hours for NHS workers. So please use our letter that's available on the RPS website if that will help with situations. We have new educational material that's available on the RPS website for everyone to access, whether it be information on critical care, evidence-based approaches to medicines management, and how to do good infection control management during COVID-19. There's lots of other information on there around volunteering programme, returning to practice, pharmacy guidances as well for you to access for free. We've also started work around a Pharmacy Heroes campaign this week to showcase the fantastic work that pharmacy teams are doing on the front line, elevating their stories to national level about the phenomenal work you and your teams are doing on a day-to-day basis. I know for many pharmacy teams, this weekend is not going to be a restful weekend. Today, leading up to Easter, is always really busy, and with the requirement of many pharmacy teams having to open during Easter bank holiday, we appreciate the stress and pressures that puts on you and your support teams. I know this might not sound like much, but you are doing a fantastic job and you're making the profession ever so proud of your contributions. The government recognises this and the NHS recognise it. I'm hoping for more further and positive information around how other aspects of government and the NHS look to support pharmacy teams across the entirety of the healthcare system further next week. We are not stopping our fight. We're continuing to work hard for you and lobbying on the behalf of you and the profession. I hope at some point over the Easter bank holiday weekend you manage to get some downtime and rest. I know it's much needed. And thank you once again for all the work you are doing on the front line. Appreciate it, and I shall catch up with you all next week. Bye.